Performance figures show Knox County ambulances are responding to calls more quickly and getting back on the roads quicker. We have previously reported on AMR's slow response times, and while times are improving, leaders say more can be done. 10 News reporter Lauren Lovett spoke with a leader at the ambulance provider about improvements and what this year will look like. Lauren?
Brittany, compared to 2023, AMR reduced offload times in 2024 by an average of 7 minutes. While that might not seem like much, the reduction plus other small improvements equals a big difference for people waiting to get emergency care. AMR has faced several problems in Knox County the past few years, from not responding in time to over hour-long offload times. While those issues haven't been solved, leaders say there have been major improvements.
We typically cite the increase in staffing because that means more ambulances are on the road, and that reduces the amount of time anyone has to wait for an ambulance. The hospitals have been extremely cooperative in trying to find ways to move patients through the hospital.
Jerry Harnish, AMR's operations director, says they've also been able to divert more calls. About 1/3 of the calls they receive each year are now being handled without sending an ambulance. One focus point, the so-called Mission District on Broadway. They're working with several local agencies to provide basic wound care without taking ambulances out of rotation.
These people do need care. It's just that a hospital emergency room isn't usually the best care they could get.
One of the biggest successes they've seen so far is a reduction in offload times. That's the time it takes for a patient to be admitted to the emergency room from the ambulance. Just a 7-minute difference has a big impact when applied to the over 40,000 transports AMR completes each year.
It's the equivalent of adding an ambulance to the system every day. And so every little bit helps. An extra ambulance every day certainly helps.
Harnish says they still have a goal of 30-minute offload times. He says it won't be easy, but it is possible, especially with some specific areas they're focusing on this year, including scheduling ambulances when needed, 911 taking over dispatch, and changes within hospital systems. AMR says while challenges persist, the numbers from last year show they're making progress. They say they're determined to provide high-quality care and are optimistic that response and offload times will get shorter. Brittany?
Lauren, thank you.